Hello, today we will be talking about quantitative research designs. This mind map basically breaks it down from the quantitative side with the positive paradigm and the conservative naturalist paradigm with the qualitative design on the other side. And so we'll talk today about experimental with true experimental design, what makes quasi-experimental design different from true experimental. Then we'll talk about non-experimental designs in quantitative research with correlational and descriptive design. We talked before about sampling plans and how those work, and that you have to test the hypothesis with quantitative research. You have to have a setting, which is where it takes place. If you see S or SS, that's the subjects. Remember that big N and little n in your inclusion criteria is telling us how many subjects there are. So you want to make sure that you're actually including that in your discussions, not just that there's a lot of them, but like tell us the N, tell us how many that there are. The sampling, how was it selected, if you can figure that out. If you can try to determine how the sampling plan was selected. Treatment and intervention. First thing that you want to be able to do is look at the article and determine, was there an intervention? And I'll show you that with this presentation. I've got some examples. Data collection. Did they do something to measure? And if so, how did they measure it? And then analysis of the data. How did they analyze the data? Was there statistics used? And that's really what we're looking at when we're critiquing. And that's what you guys are doing now. So again, with the quantitative design, there's experimental, there's quasi, non-experimental with correlation and descriptive. I'm going to tell you right now, in nursing and in education, the most common one that you're going to see is quasi-experimental design. We are striving for rigor with excellence, high standards. We want accuracy. We want ethical treatment with all types of research. But we know that randomized controlled trials is, if you look at the pyramids of what's the most rigorous, that's what it is. But it's just also not going to be the easiest thing with ethics. If you go back and you look at those ethical things, it's not easy to fulfill everything that we need to get a true experimental design, and it's much easier to get quasi-experimental. So with experimental research, does treating subjects in different ways cause differences in the outcomes? Remember, we are trying to look at a relationship between the independent variable and the dependent variable. We're looking at cause and effect. So this is the gold standard for research. And that's what a true experiment is. So we have to have manipulation, and that's the intervention. We have to have a control group, and we have to have randomization. If we have all of those and they're in place, then we have a true experiment. So the researcher introduces an intervention. We manipulate the independent variable, and I always think of the intervention as the independent variable. That helps me to remember the independent variable, and we're assessing that to impact the dependent variable. So the dependent variable is always the outcome. So different interventions may be done to different groups and the results assessed. The experimental group is the treatment group, so that's who's going to get the intervention. And the control group is who should not be getting any kind of treatment. This is who should be getting either an alternative treatment or a placebo or no treatment at all. And this is where we really get into the ethics thing with the true experiment. This works fine for drug trials because we can put them on placebo or we can put them on a wait list or something like that. But with a lot of the things that we do in healthcare, a control group isn't really necessarily going to work, especially if we start seeing really good results. It's not really fair or equitable to not give those patients treatment. So if a researcher introduces an intervention, like they teach to group A and they don't teach to group B, that's manipulation. If we give a med to group A and we give a placebo to group B, that's manipulation. If we lecture to group A, we use discussion for group B, and we just do online for group C, that's manipulation and comparison. If we're doing some circumcisions with babies, this is a common one, we can use a sucrose pacifier with group A, use music therapy with group B, use a sucrose pacifier and music with group C, and do nothing for group D. And we're trying to see what is the best method. So here is an example from an article, from an old one. Improving depressive symptoms in community-dwelling older adults. This is from the Journal of Gerontological Nursing. The purpose of the study was to measure the efficacy of an intervention that combined the activities of life review and writing on the depressive symptoms of community-dwelling older adults. Erickson's theory of human development is the guiding theoretical framework. Hey, look at that. They told us what the theory was, so they used Erickson. And so if we looked for a picture of Erickson's theory of human development in Google Images, we would be able to find the theoretical framework. The treatment group participated in a high-intensity 2-hour, 10-week group intervention that included both writing and sharing life stories. So what's the dependent variable? So if we're looking for the dependent variable, we're looking for the outcomes here. So we're trying to measure efficacy. That's our outcome. The independent variable is this high-intensity 2-hour, 10-week group intervention that's got writing and sharing life stories. And what's the purpose? It's to measure the efficacy of an intervention, and I mean they basically outline the whole purpose right there in the first sentence. Did they use manipulation to assess the impact of the independent variable on the dependent variable? And we can answer yes, because they have an intervention that they manipulated. So, a control is something that eliminates possible outside influences. So when we talk about confounding variables, if you don't have a control group, you can always have something else that explains what happened in the experiment. So control eliminates possible outside influences on the dependent variable so that the true relationship between the independent variable and the dependent variable can be understood. So if there's random assignment to a control and experimental groups, and you use only homogeneous subjects, or you use matching pairs of subjects and in an experimental group and in a control group, then you've got a really good control in a true experiment. So we've broken them up into an experimental group and into a control group, and we are doing an intervention with one, and maybe we're doing a placebo with one, or we're doing alternative therapy, or we're not doing anything with the other group. But that gives us true control to say that this actually is what caused the relationship. So, a control group is, they aren't getting the major treatment. And this is comparing with the experimental group. So in that same article that I gave you, they used random assignment. They did a coin toss. So with that coin toss, if you remember talking about sampling, that would be simple random. They participated in a 2-hour group once a week for 10 weeks with the treatment and experimental groups. The control group, they put them on a wait list for the group and had no intervention. Now, that's how they handled the ethics. They put them on a wait list and didn't have an intervention. Did they use control in their study? We can say yes, they did. Randomization of the subjects is assigning to treatment and control groups in a random manner. Random assignment allows the assumption that the experiment and the control groups are equivalent. This is basically that the researcher doesn't handpick who's going in what group. This provides an increased confidence that the difference in the group outcomes could only come from the intervention and treatment or random error. It's limiting bias, limiting researcher bias. Random selection is equal to random sampling of the subjects to be in the study, whereas random assignment of the subjects is putting them into experimental or control groups. Oftentimes both are used in experimental design. You only have to do one of these in experimental design. You just have to have some type of randomization. But a really well done experimental design will do both. So the three major categories that must be present to be a true experiment are manipulation, control or to have a control group, and there has to be some type of randomization into a treatment group and a control group. The advantages is that this is the best way to answer your questions. We don't have a lot of confounding variables that can be another reason for saying that there was a relationship. We have a fairly high confidence that the treatment intervention actually caused the effect. The disadvantages is that we can't usually randomly assign people to experimental and control groups related to health, and this is the ethical issue. We can't ethically assign people to some treatment and control groups. It's just very difficult. And getting IRBs on board for these kinds of true experiments with health or with education is not an easy buy-in. Now, the second type of quantitative study that is most common is quasi-experimental. We still have an experiment. We still use manipulation to assess the impact of the independent variable on the dependent variable, but we're just missing one thing. We can lack a control group, we can lack randomization, or we can lack both the control and randomization. So you can either lack one of those things or all of those things. As long as you've got an intervention, you're quasi-experimental. In nursing, it's just more practical to do than experimental design. Don't talk about using any kind of control, do they? No. They just took what they could get. So I don't hear any of that or any randomization. So that tells us that we have a quasi-experimental design. So if a study uses manipulation and they've got an intervention, and if they are lacking control, or if they are lacking randomization, or if they are lacking both of those, then it becomes a quasi-experimental design. Advantage, this is a lot more practical, it's cheaper. Gives some control when full control and randomization are not practical. This researcher could have made it a little tighter if they wanted to divide their groups into a control group and that didn't get the experiment and one that did. The disadvantages are without full control, it's much harder to show a cause and effect relationship because they'll say that there are confounding variables, that there's always one other reason for your results. With non-experimental research, there's no manipulation of the independent variable, no treatment, no intervention. And so sometimes with quantitative research that is descriptive in nature, people get it mixed up with qualitative, so be very careful here. And this sounds qualitative. What impact does widowhood have on coping with the loss of a grown child? If you were to read that, you might think it's qualitative in nature, so you might need to read the research article a little bit further to understand if it's quantitative or qualitative. What are the psychosocial needs of women with breast cancer? I can tell you right now, I could read that and say, okay, that's a needs assessment, so they use some kind of a survey tool. Is there a relationship between low birth weight and readiness for school? Well, if there's a relationship between low birth weight and readiness for school, then they're looking at something retrospectively and they're looking at correlation, and I can pick that up from that. But what impact does widowhood have on coping with the loss of a grown child? Okay, well, if we're talking about widowhood and coping with the loss of a grown child, and you're thinking about that, okay, they're probably trying to do some correlation there too. But it could also be qualitative, so sometimes you have to read just a little bit further. They're using naturally occurring groups. There's descriptive and there's correlational. Basically, with descriptive, it is like qualitative in that we don't know anything about it, so they're starting there. But again, with this positivist paradigm, instead of doing qualitative and going with, doing interviews, they like to observe, describe, and document the phenomenon, not really look for cause and effect. It's foundational. They're not going to manipulate, control, or randomize, but don't confuse it with qualitative because it's descriptive in nature, and they are still going to probably use some kind of a tool, whether it be a needs assessment or whether it be something that has some kind of numbers attached to it. Here's an example. Ward did a perceived needs of parents of critically ill infants in NICU. The purpose was to identify the perceived needs of parents of infants in a NICU. The sample size was 52 parents of NICU infants who volunteered to complete an instrument. If you hear instrument, you know that that's quantitative. NICU Family Needs Inventory. That is the name of the instrument that they used. It identified the 10 most important and the 10 least important needs of mothers and fathers. So basically they had them fill out this instrument, and then that told them the needs of the parents that were living in the NICU. And so it's quantitative in nature, but there's no experiment. And so this is a descriptive quantitative design. Did the study use manipulation? Nope. Was there control? Nope. Was there randomization? Nope. Was it a naturally occurring group? Yeah, this is parents in the NICU. Were they trying to determine cause and effect? No, they're just trying to do a needs assessment. What was the research purpose? They wanted to find out the needs of the parents living in the NICU. Correlational research. This is after the fact. So you think of retrospective. This is looking at variables after they've already occurred. You don't manipulate, control, or randomize. This looks at the degree of relationship between two or more variables. They don't show cause and effect. Here's an example. Early risk indicators of substance abuse among nurses. To investigate early risk factors that led to substance-related disorders and to discriminate between impaired and non-impaired RNs based on those risk factors. They had a convenient sample, so they took what they could get, and of course these are also hoping that people are telling the truth. 100 impaired nurses or non-impaired, 100 non-impaired nurses. So basically they would have 200 here, and then that's in their purpose is to investigate risk factors that led to substance abuse, discriminating between impaired and non-impaired RN. So the questionnaire used questions from 3 measurement tools: sensation seeking scale, the alcohol risk survey, and then the children of alcoholics screening test. And the 2 groups had statistically different scores on the 3 instruments. So they're correlating. Did it manipulate? No. Did it control? They did have 2 groups, but they weren't controlling the groups. They're just trying to compare them, and it's retrospective. Randomization? Nope. Did it describe or look at the relationships between the variables? We're just trying to look at the information retrospectively. Was it prospective or retrospective? It's retrospective. We're actually looking at the relationships between impaired and non-impaired RNs. So the big thing here is that you always have to remember, because as a student, and especially as a research student, I would want to do my independent variable, my dependent variable, and then I also wanted to look at correlation, but you can't do that. It's one or the other, because correlation does not prove causation. So So if a study has no manipulation, it's using naturally occurring groups, it's non-experimental, then you have to determine if it's descriptive or correlational. And if it's retrospective and you're looking at data comparing two groups, it's pretty easy to figure out that it's correlational. If you could plot it out and determine if we're looking at the relationship between those two groups, that's pretty easy to determine. If a study uses manipulation, has control, and randomization, it's experimental. If it's missing one of those things, it just becomes quasi. So the advantages of non-experimental research is that it can be used in situations where manipulation isn't possible or ethical. It gives us some groundwork information where future studies can be built. It cannot demonstrate cause and effect relationships. That's a major disadvantage.